When working with impressions, it's important to know the difference between a maxillary tray versus a mandibular tray. On this bottom row here, these are all of our maxillary trays. You can tell because there is a palate here, which is important when you're working on getting a denture made, a partial made, retainers, or anything like that. You need a good impression of the palate to create that suction. These are our mandibular trays. You will see almost has this U shape here, which is going to be used to not get an impression of the tongue. There are a lot of different sizes of trays. They are going to be color coded based upon the size. First thing you're going to want to do before you work with alginate is make sure that you have your PPE on. It's important to wear gloves, mask, everything, so that way you can protect yourself. You have to think that if alginate is a powder and it turns into this gooey type of solution when you mix water with it, you don't want to inhale that for it to get into your system. Making sure that you have all of your essentials. You want to make sure you have a few tray sizes or a tray that you know fits your patient, your mixing bowls, your spatulas, and then your portion cups for your water, and last but not least, your alginate. The first thing you do when you get your alginate is you want to make sure that you fluff this material. So have one hand on the lid. Sometimes the lid doesn't close all the way, so make sure you have a good grip on that, as well as the bottom. You can tell that this material kind of gets condensed a little bit, so you always want to fluff that material before opening it. So first thing you're going to do is kind of find your measuring cup. Sometimes you do have to dig a little bit for it. So you want to get a nice big scoop. You want to tap it and swipe it off so that way you know you're getting an even measurement. In this example, we're going to do 3 scoops of powder just because we would rather have extra for our students that are using it, but your office will have a ratio that they will prefer for you to use. For measuring out our water, we have these little measuring tools. If you're in the school, we do have these students use these. Like I said, it is going to be an even ratio. So since we did 3 scoops of alginate, we're going to measure to the 3rd line of water. The temperature of the water does matter in how fast your alginate is going to set up. If the water is colder, then your material will take a longer amount of time to set up. If your water is hotter, then your material will set up faster. And you have to think in a patient's mouth, there's humidity, there's moisture. So in the patient's mouth, that material is already going to set up quicker than it would outside of the mouth. So you just need to take into account how fast you can mix your material, load it into your tray, and place it in the patient's mouth. Okay, so I tried my impression trays in on my patient and found out that these are the ones that fit best for her. Now I'm going to start mixing my impression material. I make sure that my patient has their PPE, which is a bib, safety goggles, or their own glasses if they prefer. And I always give some additional paper towels just in case you drool or anything like that, because that's bound to happen. So first thing I'm gonna do is I'm gonna pick up my bowl. I'm going to pour one of my water in there, and I'm going to start incorporating it together, our powder and our liquid at the same time. Once I see it's come to this consistency, I'm going to turn my bowl to the side, and I'm going to start smushing it along the edges. Remember, you do have to work fast because this material does set up. It is about, I would say, depending on the type of material the alginate is, and the temperature of the water can be anywhere between 1 to 2 minute time. So once you have a smooth consistency, which is what you want, I grab a big scoop. I'm gonna start with my maxillary impression tray first. I'm gonna load it from the back of the tray like so, push it forward, and I'm going to lock it through the sides here of this impression tray, so that way when I'm taking this out of the patient's mouth, that material does not come out of this tray. I don't want to overload it, but I want to make sure that everything is filled. I always like to put a little test on my hand so that way I can test to see how fast this material is setting up. And now I'm going to go place it on my patient. So when taking a maxillary impression, you always stand from behind. I'm going to retract with one cheek and use the tray to retract the patient's other cheek. Going to find the distal of her last molar. I'm going to come around and wrap this lip all the way up and around. I'm going to make sure my patient's head is forward so that material doesn't run to the back of their throat. And I'm going to constantly rub my patient's lips so that way I can get a nice lip roll. It's always important to keep 2 fingers in the patient's mouth at all times. I like to use either 2 individual fingers or a peace sign and go all the way to the distal of the last molar and apply a little bit of pressure going up, just so that way I'm making sure that I'm getting a good impression of those teeth. So it's important when you take this out that you have a nice lip roll. I have a very good impression of our patient's frenum, which once again is important when you are making dentures or partials. A good palate. I have the distal of the last molar and I can see all of the teeth, which is perfect. All right, so when I'm loading my mandibular impression tray, I always start in the tongue, move it around. Once again, you want to make sure that you are locking it in that tray. So that way, once again, that impression material does not come out. You don't want to overload the tray and have way too much, but you also want to clean out this tongue area since you do not need an impression of the tongue. When placing our mandibular impression, I'm going to retract, go down, have the patient lift their tongue, and then rest it. Once again, I have a little tester on my glove to check and see when that material is set up. I have 2 fingers all the way to the distal of the last molar to apply a little bit of pressure, and I'm going to constantly massage this lip so that way I can get a good impression of the frenum and the vestibule. Okay, so this is our lower impression once we take it out of our patient's mouth. You can see that we have a really nice lip roll here, a good impression of the frenum. I have the distals of the last molars, and I have all of the teeth and no impression of the tongue.